Baby born with a giant head, and her story left everyone speechless. Big head, weird head, head like a mushroom. These are among the distasteful and insensitive remarks often hurled at hydrocephalus patients, namely those with excess liquid inside the brain, which forces the head to swell beyond normal. Several parents of these special children have conceded that acquaintances and even some of their own relatives had uttered words to insinuate that what occurred to their loved ones was the result of their own previous transgressions. These heartbreaking pictures show a rural Indian girl of just 18 months old suffering from hydrocephalus, a buildup of fluid inside the skull. The toddler, whose head swelled to 3 times its normal size, is smiling for the first time after surgery to reduce the circumference from 37 to 23 inches. The family of Runa Begum, from the village of Jarinia in India's northeastern state of Tripura, cannot afford to pay for her to be treated. Her father, Abdul Rahman, 26, works in a brick factory, where he earns the equivalent of just £1.79 a day. Babies who are born with hydrocephalus would normally require prompt surgical treatment to avoid being left permanently disabled. But without the means to pay for a doctor, Mr. Rahman and his family can only do their best to keep Runa comfortable as they watch her condition slowly and relentlessly deteriorate. Sometimes misleadingly known as water on the brain, hydrocephalus is caused by a buildup of the cerebrospinal fluid inside the skull, increasing the pressure on the brain inside. The brain constantly produces new cerebrospinal fluid at a rate of about a pint a day, while old fluid is released from the brain and reabsorbed into the blood vessels. But if this process is interrupted, as in individuals with hydrocephalus, levels of the fluid can quickly build up and place pressure on the brain, causing headaches, blurred vision, and eventually permanent brain damage. Left untreated, if it progresses quickly, the babies usually die because their brain tissues are unable to adapt, says Gil Yaz, Health Development Manager for Shine, a UK charity that has helped to set up people affected by hydrocephalus. But, she added, if the condition develops more slowly, as in Runa's case, the child adapts by growing their skull to contain the excess fluid. However, the adaptation can only go so far. The main treatment for hydrocephalus is to implant a thin tube called a shunt in the brain to drain excess cerebral spinal fluid to another part of the body where it can be more easily reabsorbed. The shunt has a valve inside it to control the flow of fluid and to ensure it does not drain too quickly, which those treated can feel as a lump under the skin of their scalps. Miss Yaz told Mail Online it's done by pediatric neurosurgeons, but it's not a very demanding procedure. The operation usually lasts about 30 minutes. The shunts themselves usually cost a few £100, she says, going to upward of £800 for state-of-the-art models. A spokesman for Headway, the Brain Injury Association, told Mail Online that shunting is very effective, but there can be complications of infections, obstructed shunts, and hematomas. These are avoided by another operation called a third ventriculostomy. This involves creating a hole in the floor of the third ventricle for the fluid to drain through. He said adding this is only suitable for some types of hydrocephalus. Experts estimate that the congenital form of the condition affects around 1 in every 500 children. It can be caused by birth defects like spina bifida or as the result of an infection that the mother develops during pregnancy, such as mumps or rubella. The condition can also be acquired after birth by both adults and children, often as the result of a serious head injury or medical condition such as a brain tumor. Without an expert medical opinion, it's impossible to know how Runa came to be affected by hydrocephalus and impossible to know what related conditions she might be suffering from. In the West, children diagnosed with the disorder and promptly treated can go on to lead normal lives. In India, things are different. In a blunt assessment of his government's failure to extend a social safety net for the poor, India's Rural Development Minister said last year that the country's public health system had collapsed. But experts say it's too late for Runa, as any surgery could be fatal. Mr. Sanjbasi, consultant adult and pediatric neurosurgeon at King's College Hospital, said, "It is too late to do anything now. The brain will be damaged, and draining the fluid can cause problems by causing the brain to collapse and bleed." Runa should really be left untreated. She will not make any recovery and will not ever live a life of any independence. Hydrocephalus is very common, and we see it to this extent very commonly in developing nations. "I can play, but I have to be careful and not be too boisterous, as my head is very heavy, so I can easily fall if I'm not careful," said Runa Begum, who spoke fluently during an interview via video call with Burnama. Asked about her ambition, Runa Begum, who only began to walk at the age of 3, could not keep her composure when admitting that she was aware of the fate of someone with her condition, and dared not to harbor any lofty dreams apart from doing her best in studies. "So, if the doctors can guarantee the surgery will definitely make her better and make her able to sit up, talk, and be like a normal kid, then we would want it." The special child ended the conversation with Burnama with the message, "Parents or families with a child like me must accept it as a test from Allah." To fellow friends who are like me, persons with disabilities, we must remember that we are the much beloved children, Burnama.